Hi, it's Dr. Hertzberg, and we're going to talk about chasing cholesterol. Everybody's told that cholesterol is the reason that your arteries block up, but in fact that's not true. Arteries block up because of inflammation. And I want to kind of use this room as an example of a heart artery and show you what I'm talking about. So let's pretend that we're floating through a heart artery right now. Every artery in the body, including the heart arteries, have a liner inside that protects it. That liner is called endothelial liner, and if that liner stays healthy, you will never have a blockage. But what happens is, one little spot of that liner, like over here, starts to get red. It's inflamed. Now, it's not the whole liner, it's just that one spot. And that inflammation begins to break down the natural protective barrier of that part of the artery liner. Now, that causes cracks to occur. Now we start to talk about the LDL, because the LDL can complex to form a thing called Lp(a), and that is sticky. And so that sticky LDL complex can come in and get caught in the cracks, and that's how you get plaque. But remember, it's not a cholesterol problem. It started with inflammation of this liner. Now, the reason this liner gets inflamed is, there are multiple reasons. One of the big ones is insulin, which we'll talk about in the future, about eating the right way, keeping the insulin low in your diet. But a very big reason is air pollution. Now, 11 years ago, in the big heart journal called Circulation, there were articles written about fine particulates in the air. They're called PM, particulate matter. And since that time, there have been 5 big studies on this. There have been multiple editorials in that heart journal that every cardiologist reads. There have been 2 studies in the New England Journal of Medicine that every physician reads. And the American Heart Association has had a 5-year and a 10-year subcommittee look at the data, and everybody is pointing out that fine particulates in the air are causing this problem, and you don't hear anybody talking about it. Now, in Michigan, we have DTE, which has 6 smokestacks, which they have not cleaned up. And I just wonder, don't the children of the board members of DTE breathe the same air you and I do? So if you really want to keep inflammation out of your artery, make sure you eat right and stop breathing. Right now, in this room, as I breathe the air, I am probably inflaming my arteries. So there's not too much I can do to really stop this. And by the way, there are 6 blood tests that can be done to measure this, and you can have heart-sensitive C-reactive protein, homocysteine, fibrinogen, and antigen, interleukin-6. You might want to talk to your doctor about doing some of those tests to find out if your arteries are inflamed. So, chasing the cholesterol is really a secondary step. The primary step is dealing with the inflammation. Now, I want to show you my prejudice, because I don't particularly like large drug companies. They have everybody thinking about step 2 and nobody thinking about step 1, because they can do nothing about step 1. So let's look at what happens if you treat cholesterol with a statin drug, and does it work? Well, if I get the cholesterol low enough in the body, it's true that it's less likely to get in these cracks. So taking cholesterol medicine, if you take enough of it, probably does help keep your arteries clean. But look at the price you pay. Now, I don't know if this will come through good, but I want to show you something, and anybody can look this up. All I did was Google FDA warnings on statin drugs, and you see this is the FDA website, and you'll see on here that the warnings include not just liver damage or muscle damage, but loss of memory and cognitive problems and development of diabetes and elevation of blood sugar, and plus you have the muscle damage that everybody knows happens with statin drugs. Why is this happening? Why are people losing their memories or having diabetes develop and so on? Because statin drugs are very powerful. Your brain is 1/3 cholesterol. If you really take all the cholesterol down in your body to 0, I get that it won't get in the cracks of your arteries, but you're not going to remember where your keys are. And so I don't really like the idea of taking all this medicine. Instead, I like the idea of dealing with this. Now, about 40 some odd years ago, one of the smartest men who ever lived, who happened to not be a doctor, was Linus Pauling. Linus Pauling won 2 unshared Nobel Prizes. He was a genius. And he looked at this and he said, you know, if you look at this inflammation under the microscope, it looks exactly like scurvy, which is a vitamin C deficiency disease. And he found that animals that don't make their own vitamin C are the ones that block up arteries and veins, but if animals make their own vitamin C, they don't. And he proposed that you could take care of this inflammation with vitamin C. Now, what he recommended back then, the oral doses, would probably give you an ulcer today. So what we found is that if you take a high dose vitamin C intravenously, about every 4 to 6 weeks, you're going to heal these spots, not for very long, probably about 36 hours, but then on a daily basis, if you take 3,000 of vitamin C and you take some lecithin, which makes that LDL complex kind of slippery, you're going to get artery protection and not have to take the cholesterol medicine. Now I want to tell you about me. I have terribly high cholesterol. And I had a heart catheterization. You know, you take your wife to the cardiologist and she says, he's a 66-year-old triathlete, how do I know he's not going to drown? And so the cardiologist asked me, do I really want to find out? So I had a heart catheterization. And my arteries were perfect. Now, right at the catheterization, my cardiologist is writing me a prescription for Lipitor. And I said, what are you doing that for? You just looked at perfect arteries. He says, your cholesterol's high. I said, look, I have perfect arteries. You think I'm going to take a drug? And he looked at me and said, I don't get it. He actually did not know anything about the wall inflammation. That's the brainwashing that's taken place in medicine with physicians. Now, I want to tell you, I have nothing against people taking statin drugs, but I'm very scared of them. I find them to be very toxic, and so does the FDA. What I do believe in is the genius, Linus Pauling. I get an intravenous every 4 to 6 weeks. I take 3,000 of vitamin C every day, and I take a couple of lecithin, and I believe my heart arteries are going to stay clear, and I think you should consider this too. Thank you.